Everyone's heard it. Philadelphia looks like a city of The Walking Dead. Not the Hollywood kind, but real people barely hanging on, wandering the streets with nowhere to go, lost in a haze of fentanyl, thin, exhausted, and forgotten.
I don't know what else to do. This dope is like really fucked up out here, or whatever it is, whatever they got us on. Like, this is where people either, you only come here either to get money, to get high, and that's it. There's no other option out this place.
You've seen the videos. Maybe you scrolled past them, but this isn't just Philly's problem. Across Pennsylvania, from Erie to Harrisburg, the crisis is everywhere. And no, it's not just about junkies or criminals like the headlines want you to believe. It's families, it's veterans, it's young people who aged out of the system, it's folks who got sick or injured and couldn't keep up with the rent. Being homeless in Pennsylvania isn't some one-off problem. It's part of the larger disaster we now call homeless in America. The shelters are overflowing. Affordable housing is a fantasy.
That's something that happened with me due to my addiction. I lost my house. Had my own first house, so I lost that because I wasn't making payments because my money was going to drugs.
Like, I know they're trying to clean it up right now, but I don't know where they expect everyone to go.
And the people in charge? They toss around a few $1 million and act like the job's done while tents keep popping up under every overpass. This video isn't here to shock you. It's not about pity or blame either. It's about truth, what's actually happening out here, how people end up on the street, why they can't get out, and whether anyone's really doing something to fix it. So let's get real. Let's talk about what it means to be homeless in Pennsylvania right now. Let's be honest, if you've driven through Philly lately, or even passed by parts of Harrisburg or Pittsburgh, you've likely seen the signs. Tents on sidewalks, people pushing carts filled with everything they own, cardboard signs at red lights asking for help. Homelessness in Pennsylvania isn't hidden. It's out in the open, getting worse with every passing year. In just the first half of 2025, the federal count found nearly 14,000 people experiencing homelessness across the state. That's a staggering figure. That includes people in shelters, transitional housing, and many who are just trying to survive outside. On any given night, more than 12,000 Pennsylvanians are sleeping without a stable home. That number isn't just data, it represents thousands of human lives caught in crisis. And this isn't only a Philadelphia issue. You'll find the same in Scranton, Allentown, Erie, you name it. And while drugs and mental illness are a part of the picture, they're far from the whole story. We're talking about veterans, single moms, workers who got laid off, and young people who've aged out of foster care. Many of them were living normal lives not long ago with jobs and a place to call home. Nationwide, around 30% of the homeless population is chronically homeless, meaning they've been without stable housing for at least a year, or have cycled in and out of homelessness repeatedly. And more of these folks are now living on the streets instead of shelters. That same trend is hitting Pennsylvania hard. It's not just individuals anymore. Families are getting swept up in the crisis too. Shelters across the state report rising numbers of single mothers with kids and young adults with nowhere to turn. This lines up with the wider reality of homeless in America, where full families are being pushed into homelessness faster than the system can handle. Back in 2019, there were almost 12,000 homeless people in the state. By 2021, it had climbed to over 13,500. Now, in 2025, we've blown past that, and the numbers keep rising. Nationwide, the homeless population jumped 18% in just 1 year, topping 770,000 people. In Philly's Kensington neighborhood, it's like walking through a live drug market. People using out in the open gathering in huge groups like the police have just disappeared from the area. It makes you wonder, if this keeps spiraling, will Pennsylvanians have anything left of the American dream? Because right now it feels like it's already crumbling. People always say homelessness is a choice. I never believed that until I saw what was really going on in Kensington last July. When we talk about homelessness, addiction is often one of the first things people bring up. And while it's wrong to assume everyone living on the street is using drugs, we also can't pretend it's not a major issue. In Pennsylvania, especially in Philadelphia's Kensington neighborhood, addiction is deeply tied to the homeless crisis. Let's look at the numbers. The Substance Abuse and Mental Health Services Administration estimates that about 38% of people experiencing homelessness in the US are struggling with a substance use disorder.
I guess the pain of the depression, the drugs made it feel better. It made me feel normal. I didn't feel...
In Pennsylvania's cities, the numbers are likely even higher. That means for every 10 people living unhoused, 3 or 4 are likely battling addiction. But instead of receiving care, many are pushed further away from society, from support, and deeper into addiction. Here's the truth. Addiction usually isn't what causes homelessness. In most cases, it comes after people lose their housing, not before. Just imagine trying to survive night after night, in the freezing cold with no safety, no quiet, no comfort. Wouldn't you look for a way to numb that pain too? And that leads to a bigger question: why is treatment so hard to find? If addiction is such a big part of the problem, why aren't we seeing more mobile detox units, more recovery-focused housing, or mental health professionals out where people actually need them? It can't just be about telling people to stop using drugs. We need to understand the reasons behind it and offer real human ways out. Thankfully, there are signs of progress. In places like Philly and Pittsburgh, outreach teams are doing the hard work, building trust, giving out Narcan, and offering immediate help for those ready to take the first step. Addiction is a hard reality, but it's not a dead end. It's not about blaming, it's about healing. And if we really want to address the homeless in America crisis, this kind of support needs to grow, not disappear. Let's rewind a few years. Even before the pandemic, life was already a daily struggle for those living paycheck to paycheck. Rents were climbing, shelters were overcrowded, and countless families were one emergency away from losing their homes. Then COVID-19 arrived, and it was like the bottom dropped out from under tens of thousands of families across Pennsylvania and the nation. Businesses closed their doors overnight, jobs vanished without notice. No time to prepare, no safety net, just gone. Some managed to get by with unemployment checks or stimulus payments, but many, especially those in under-the-table work or low-paying service jobs, got nothing. And when the income stopped, rent stopped getting paid. For a while, eviction moratoriums offered a lifeline, but once those were lifted, the flood of overdue rent came crashing in. In Pennsylvania, eviction cases surged as soon as the protections expired, but housing wasn't the only thing on the line. The pandemic forced shelters to change how they operated. To limit the virus's spread, many reduced bed space shut down shared areas or closed altogether for weeks or months. That meant fewer places for people to go, and more of them ended up sleeping on the streets. Some local governments tried using hotel rooms as a stopgap, but those efforts were short-term and couldn't meet the growing need. Meanwhile, COVID took a massive toll on mental health. Isolation fear and financial loss sent people spiraling. For those already teetering on the edge, the pandemic pushed them further. And for many who had never been homeless before, it became their new reality. So, what did this mean for the broader picture of homeless in America? COVID didn't cause homelessness, but it laid bare just how fragile and broken our safety nets really are. A single virus shouldn't have the power to tip so many lives into crisis, but it did. And if it happened once, what's to stop it from happening again? That's a question we need to take seriously. Because if we don't take the lesson to heart, the next crisis could hit even harder. The pandemic should have been a wake-up call. The real question is, did anyone hear it? Most people can already feel it deep down. Housing has become way too expensive. Whether you're trying to rent a small place or buy your first home, the cost of simply having shelter in Pennsylvania keeps rising. And for those barely getting by, it doesn't take much to slip into homelessness. This housing crisis isn't just some unfortunate twist of fate. It's one of the core reasons why more and more people are ending up without a home. Let's break it down. In Pennsylvania, the average fair market rent for a one-bedroom apartment is now more than $900 a month. That might seem reasonable in cities like New York or San Francisco, but here, where the minimum wage is still locked at $7.25 an hour, that kind of rent is out of reach unless you're juggling 2 or 3 jobs. And that's assuming you have reliable work to begin with. Experts say you'd need to earn at least $18 an hour to afford that rent without being considered cost-burdened. But many people, especially seniors, people on disability, or those with limited income, aren't even close to that threshold. Meanwhile, affordable housing is disappearing fast. Public housing units are being demolished and new developments are going up, but they're usually luxury apartments, not affordable homes for working families. Gentrification in cities like Philadelphia and Pittsburgh is only making things worse. As neighborhoods are revitalized, longtime residents are priced out. They aren't moving to better places. They're just moving out often with nowhere to land. In rural Pennsylvania, the problem isn't always high rent, it's a lack of options. Some towns just don't have enough housing, period. So when a trailer park closes or a rental home is condemned, people are left with no backup. And when folks can't afford to stay, but have nowhere else to go, they end up in shelters living in tents or sleeping in their cars. Once that happens, the cycle of poverty and homelessness becomes almost impossible to escape without serious support. And this isn't unique to Pennsylvania. Across the US, housing costs are rising faster than wages, turning homeless in America into a systemic crisis, not a result of bad decisions. So here's the question: if housing is a basic human need, why does it now feel like a luxury? Unless we start seeing real reforms, more affordable units, rent stabilization, and stronger tenant rights, the crisis will keep growing. Because the truth is simple: you can't solve homelessness without first giving people homes. What kind of real help does someone get if they become homeless in Pennsylvania? It's a valid question. Most of us want to believe there's a safety net, shelters job, programs, mental health services ready to catch people when they fall. But the truth is that net has plenty of gaps. And for far too many, it's just not strong enough to hold them up. Across Pennsylvania, some organizations are doing everything they can. In Philadelphia, groups like Project Home and Broad Street Ministry show up every single day, providing meals, medical aid, and housing support. In Pittsburgh, places like Light of Life Rescue Mission and Allegheny Link work on the front lines. These nonprofits, along with churches and community volunteers, often serve as the only support system people can rely on during their hardest moments. But the real issue is the demand far exceeds the supply. Shelters are packed especially in the cold months. Mental health support is stretched thin, and wait lists for affordable housing can last years. Caseworkers are burned out. Recovery programs are underfunded. And many people facing addiction trauma or job loss simply don't know where to turn or how to get the help they need. So is Pennsylvania ignoring the problem? Not entirely. The state does provide some programs like the Emergency Solutions Grant and Home for Good, both aimed at preventing eviction and funding temporary housing. There's also Medicaid for Behavioral Health Services and the Department of Human Services funds outreach efforts across all 67 counties. Yet if you ask people actually living on the streets, they'll often say the same thing: help exists, but it's hard to reach and even harder to keep. And when living costs keep climbing, waiting weeks or months for support can mean falling further into crisis. So here's the hard question: how can we reduce homelessness if the services meant to help are constantly overwhelmed? If we truly want to tackle the homeless in America crisis, then our social support system needs more than goodwill. It needs real funding, easier access, and a deeper commitment to treating people not as statistics but as neighbors worth helping. So what's the government actually doing about homelessness in Pennsylvania? Are we just throwing money at it, hoping the issue fades, or is there a real long-term plan in place? To be fair, there are some meaningful efforts happening. Take Home for Good. For example, a partnership between the Pennsylvania Housing Finance Agency and the Federal Home Loan Bank of Pittsburgh. This program has been working to close the funding gaps in key areas. It supports things like rental aid street outreach, rapid rehousing, and efforts to stop evictions before they happen. In 2023, more than 9,000 people across Pennsylvania received help through this initiative. That's not nothing. Then there's the Emergency Solutions Grant, which provides critical funding for shelters and related services. Major cities like Philadelphia and Pittsburgh have used these grants to build transitional housing deploy, mental health outreach teams, and provide basic needs like meals, hygiene kits, and emergency shelter beds. Some counties are even trying housing first models, getting people into permanent housing before tackling other issues like addiction or unemployment. But here's the catch. The funding doesn't last. One year there's progress, the next nothing. Much of it depends on federal support, and when priorities shift in Washington, local programs often get left behind. With housing costs climbing and inflation squeezing every budget, programs that once worked are now barely staying afloat. So yes, the government is doing something, but is it enough? Honestly, it doesn't look like it. If we really want to tackle homeless in America, we need action that's steady, strategic, and built to last. Because it's not just about throwing more money around, it's about spending wisely with follow-through that delivers real change. Let's stop pretending this is okay. The homelessness crisis in Pennsylvania and across the country isn't just a side effect of modern life. It's a man-made failure. It's what happens when leaders put donors ahead of working people, when cities fund luxury apartments but not public housing, and when poverty is blamed on the poor instead of the system. What we see on the streets isn't just tragic, it's unacceptable. This didn't happen overnight. It's the product of years of neglect, broken promises, and leaders who refuse to act. And the worst part, we've convinced ourselves it's just the way things are. That homeless in America is inevitable. But that's not the truth. We don't lack answers, we lack courage. Somehow this country always has billions for war tax breaks and corporate bailouts. But when it comes to keeping people housed, suddenly there's no money. That's not budgeting, it's cruelty. Until homelessness is treated like the national emergency, it truly is nothing will improve. No one should be forced to live in a tent just because their leaders failed them. This isn't destiny, it's a disgrace. And it's time we all said it out loud. Conclusion. The homelessness crisis in Pennsylvania isn't just about failed housing systems, it's about misplaced priorities. We've seen what drives it: addiction, unemployment, sky-high rents, and a broken mental health safety net. We've seen what it does. It rips families apart, leaves veterans stranded, and turns entire communities into ghost towns abandoned by those in power. And this isn't unique to Pennsylvania. The issue of homeless in America is a nationwide disgrace, one we keep trying to cover up instead of truly addressing at the root. But here's the thing, this is a problem we can solve. We have the resources, the research, and the ability. What we're still missing is the will, the courage to demand accountability, to rethink where our money goes, and to finally recognize that housing is a right, not a luxury. Because in a nation this wealthy, no one should be left behind in the cold. Not today, not ever.